afternoon, everybody. I get to play teacher today. So, with that said, I'd like to direct your attention to the board behind me. True or false? There are 3 methods of giving birth. If you answered false, then you are correct. There are more than 3. According to Lillington Gibbs and Ingertson's Maternity of Nursing Care, there are at least 5. The methods that I wish to talk to you about today are hydrobirth, hypnobirth, the Bradley technique, assisted birth, and cesarean sections. A common term heard in birth is natural. So what is natural birth? According to the Mosby's Dictionary of Medicine, Nursing, and Health Professions, 11th edition, natural birth is defined as being accomplished by a mother with little or no medical intervention. Hydrobirth, also known as water birth, can fall under this category. By observing water animals delivering in water, a Russian physiologist by Igor Kovarsky found that water could alleviate the impact on the fetal brain. According to an article, The Decision-Making Experience of Mothers Selecting Water Birth, in the Journal of Nursing, Volume 11, 2003, Mr. Darcy was the first to discover this method, while Dr. Mikkel Odin was the first to introduce it to a hospital in France. Hydrobirth was first introduced to the USA in 1980 by Dr. Michael Rosenthal. The mothers emerged in warm water up to her breasts, and according to Barbara Harper's article, Guidelines for a Safe Water Birth, the depth of the water is very important in order to get the full physiologic response of oxytocin and vasopressin. This happens just in 20 minutes of submersion. These responses are responsible for reducing blood pressure, reducing the risk of perinatal tearing, shortening the labor process, and enabling the mother to be in different positions. Some of you may wonder, what if the baby gets one full of water? Well, according to Greg Hawk, author of Hey, Who's Having This Baby Anyway, one reason could be that the temperature of the water goes unnoticed because it's so close to maternal mother's temp. As soon as the baby is taken out of the water, chemical and hormonal changes occur, which cause them to take their first breath. Now, reverting back to land birth, the Bradley technique is a method of giving birth in which the father is the labor coach and no medical interventions are used. The technique is centered on the father motivating and comforting the laboring mother throughout the entire process. He may implement the use of massage in order to release pain and tension, as well as participate with different breathing techniques. This is an all-natural method between the mother and father. Hypnobirth is similar to these previous 2, being that it is a natural birth. Hypnobirth is also referred to as the Mongan method, after the woman who discovered this. Marie Mongan is an award-winning hypnotherapist and founder of the Hypnobirthing Institute. She discovered this technique while her daughter was in labor. Mongan discovered this method by the philosophy of Dr. Grantley Dick Reeves. Dr. Grantley believed that the degree of fear during labor correlated with the amount of understanding of the labor. No, this method does not involve a watch or the words "you're getting very sleepy." Actually, the mother is taught to trust her body. She is trained to calm herself through breathing techniques, therapeutic touch, imagery, and music. The use of these techniques to eliminate fear and tension is said to enable the body to release endorphins, also reduce the stress hormone. This reduces the constriction of the muscles and reduces the pain. Harsh words such as contractions, labor, and pain are swapped out with words such as surges, waves, rushes, birthing, and fatigue. The benefits of this method include reducing pain levels, increasing bonding, eliminating fatigue, and the first stage may be shortened. On the hypnobirthing website, Mongan founded that it states, a study done with 100 women at the University of Vermont, there was an 81% success rate when this was used. Now, obviously not all women want to go all natural, and I can't blame them. And sometimes there are also complications. An assisted birth is implemented when the baby is having difficulty descending the birth canal. There are 2 instruments that are used depending on the baby's head and gestational age and position. Think of tongs on steroids. This is the best description for forceps. The doctor applies the forceps to the baby's head and gently pulls as the mother pushes. Forceps are also useful when the position of the infant needs to be changed in the birth canal. Also, if the baby needs to be born quickly, this is the best choice. A ventouse, also called a vacuum-assisted birth, is done by applying suction to the infant's head while the mother pushes through a contraction. During both these methods, an episiotomy may be performed. This is an incision in the perineum to increase the size of the vaginal opening. Now, what happens if that baby is being stubborn and refuses to come out when these methods are used? A cesarean section will need to be performed. The website, mayoclinic.com, defines cesarean section as a surgical procedure used to deliver a baby through an incision into the mother's abdomen and a second incision into the mother's uterus. A cesarean section, or C-section, can be pre-planned if the mother develops a complication prior to the onset of labor, or if she had a previous C-section. A pre-planned C-section is recommended when there are twins, a breech birth, or when there are STDs, or if the mother is inadequate and has inadequate hip size to deliver vaginally. Most often, however, it is used in an emergent situation. If there are problems with the placenta as well. If there are any complications I mentioned before that were not discovered until labor has set in, then an emergency section is also needed. Now keep in mind this is a major surgery, and with major surgeries are increased risks. They will have a longer recovery, increased risk for bleeding, and a scar as well. However, some of the benefits will be that the baby do not come in contact with any diseases that are related vaginally, and that distress may have been prevented. As you all have heard, there are multiple ways to give birth. Some are optional and some are not. Whether a mother has pre-selected her method, the doctor has pre-planned for a C-section, or if complications arise in which an alternative method is implemented, it is clear there are many things to consider when it comes time to give birth. Whatever method is decided, it is based on specific information and knowledge related to that specific pregnancy. So with all that said, my main point was to inform you of the different methods. So, how do y'all feel? Do y'all have any questions? I have questions for me.
What's the recovery time for a cesarean section?
About 6 weeks maybe, for the incision to fully heal. Any other questions?
Have you thought about what you're going to be planning on?
Kind of leaning toward the hydro, possibly. It sounds more relaxing. And I like the water.
Might not like the water after that.
I might not. It might be a hard memory for me to get back in the water after that. Yes, Teresa.
Did you say what the percentage for the hypnobirthing?
The hypnobirthing at the study in Vermont was 81% of a success rate. And that was the only percentage that I found on a credible site. So I don't know if anybody really wants to use that method or not. Then I have some fun comics for y'all to look at for staying, give y'all a laugh. If y'all can read them. I might be able to read that. But if y'all know who Hank Arnold is, y'all will understand this.
What's it say?
Talking about
Yep.
all-natural, he wants her to have an all-natural birth and look at his head size. Okay.
Yeah.
And that's just, thank you. Thank you again for